Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Welcome, everyone. My name is Ashley Klein-Jimenez. I am with Prevent Connect, and you are joining us for Centering the Margins, Advancing Health Equity for Sexual and Domestic Violence Prevention. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. So I am excited, as always, to be here with our colleagues, our friends, our partners at Prevention Institute. So I'd love to introduce you to Alicia Somji, who is going to lead us through this today. And Alicia, I'd love for you to introduce Abina and let us know how you're doing.
Thanks, Ashley. Yeah, I'm doing well. I'm excited that we have one of our guests with us in the room, and looking forward to also hearing from our guest in Rhode Island later today. I'm here also with my colleague Abina, who is helping web tech. Do you want to say anything?
Hi, everyone. I'm so happy to be here.
So on today's session, we're going to be identifying what is meant by terms like health equity, intersectionality, and centering the margins. Sometimes this can be kind of jargony type of language that isn't used on an everyday basis, so we really want to unpack what we mean by these things and why this language is important. We're also going to be exploring real-world examples of how advocates and practitioners are advancing health equity in their work and really building the infrastructure so that we can work towards achieving health equity. And we want to engage in a candid discussion. We want to use the text chat, speak with our guests today, and really get into how we can recenter power and how that can support safe communities and sexual and domestic violence prevention. So to start off, we'd like to hear from all of you. You picked this web conference for a reason. So we want to know, the title is Centering the Margins. So what does that mean to you? How do you go about centering the margins? What does this language really mean? We'd love for you to share in the text chat, and we'll come back to report out what people are saying. But please share there. And while you're doing that, I thought that I could start getting into a quick primer on some definitions. So health equity, unlike equality, it actually means that everyone has a fair and just opportunity to be as healthy as possible. And this means that everyone has the right to sexual and relational health as well. And so I wanted to show this graphic that I found from the Robert Wood Johnson Foundation. I know many of you may be familiar with another graphic, one that's often used has to do with a baseball field, and there's people of different heights. But I like this one as well. I thought I'd share something different, and we'll also put the link for it in the text chat in case you want to look at this some more. But equality, it shows the difference between equality and equity. So in the first graphic, you can see that everyone has been given the same bicycle, and you can see how that can be an issue for different folks. So, for example, we have the person in the wheelchair who can't even really access that bicycle because it's not possible for them to ride it. And then there's a really tall person who the bicycle, they don't fit on it, and the younger person there who also is having trouble. And then if you look at the equity picture, it's really about meeting the needs of different folks and being able to tailor to their needs so that everyone has access and the ability to physical activity and being able to ride a bicycle. And this also gets me thinking about the difference in access and need. So the person who is really tall in the equality photo, you can see that they're still able to at least sit on that bicycle and pedal. May not be the most comfortable, but they still have some access, while the person who's in the wheelchair can't even have that access. So I think equity, as that definition had shown, it really is about removing those obstacles such as poverty, discrimination, and their consequences, including things like powerlessness. So I wanted to also bring up intersectionality, which is another term that's used a lot in the movement, which is about the study of how power structures interact across multiple identities. And in our field, we're increasingly looking at how gender intersects with processes of oppression and multiple social positions such as race, class, sexuality, disability, etc. And Kimberlé Crenshaw, who coined the term, shares about how it's about power and really changing the face of power itself. And to me, that's really about what centering the margins is about. It's about changing the face of power. It's about working towards health equity. And it really involves thinking about how different power structures intersect and who's being most affected. So with that, I'd love to see what's coming up in the text chat and what people have been saying. What does centering the margins mean to them?
Yeah, so Alicia, what I've seen a lot of people are talking about is that it's really about bringing folks who have been left out of conversations and who are often the most impacted by an issue into the conversation, making space for that listening. Alejandra said we need to listen when you listen to the needs and then adjust our systems as a way to respond to what folks are telling us they need. Tori, what about you? What have you seen come up?
I saw a lot of the same things come up, too, with creating space for folks and making sure that we're listening to needs. I do also want to point out some...
Hi, how are you?
I'm going to go ahead and mute.
All guests have been muted. You can unmute your line by pressing *6.
Okay. It wouldn't be our last iLink conference without a few technical hiccups, wouldn't it? So I saw a lot of the same things that Ashley did, and I also saw someone discuss making sure that folks who we are centering are also part of the decision-making, too.
That's great. I also saw something about self-reflection, which I think is really important, so looking internally as well. So that's great, and we're going to be continuing this conversation because with us today we have Becky Misaki as our first guest, who has really been giving a lot of thought and taking action on centering the margins to achieve health equity. Becky Misaki is an independent consultant for social change and community building. Previously, she worked as a director at the Asian Pacific Institute on Gender-Based Violence, and she co-founded one of the first violence against women programs in the nation that could meet the language and cultural needs of Asian survivors of domestic violence and trafficking, which was the Asian Women's Shelter in San Francisco. And she actually served as the founding executive director there for over 21 years. Becky has extensive experience in providing multilingual, multicultural services to domestic violence and trafficking survivors and their children, innovative program development, prevention, community building, policy making, and institutional advocacy. So we're very honored to have you here today, Becky.
Thank you.
You're welcome.
Thank you.
So we thought we'd ask for our first question, since we asked the audience about what centering the margins means to them. We'd love to hear from you. What does centering the margins mean to you, and how does that relate to intersectionality?
Yes. Centering the margins means that those of us who have historically been at the margins of race and gender equity, if we just shift and make a pivot and focus us in the center, then all will rise up. You know, that benefits everybody. And I think there's so many misconceptions about that throughout time, is that when we speak up, it's like pushback. Oh, you're a special need. You're not a big, oh, that's an exception. Or, oh, you know, there's just so many different stories I have, and those are even those that are doing racism among the well-intended, let alone the very severe racist and gender discrimination and violence that we've experienced.
So what's the concept of the last girl really mean?
Yes, so the last girl, that story is that, you know, I had the opportunity of being in the first cohort, well, actually the advisory committee that shaped that, and the first cohort of the Move to End Violence program. And that was a wonderful experience. And one of our in-person convenings, we got to go on an international trip. And so we were able to go into India. And there was a national and international call to action and framework from Gandhi. And many people know of Gandhi. And Gandhi had said, it is about the last person. And there's many quotes about Gandhi who really said, if we are really going to achieve peace and justice and change in the world, it is focusing on that last person, the one that is the most vulnerable, the least, the most invisible. And if we focus that way, all of us will rise and benefit. And then in that mode, wouldn't you imagine, and it's a surprise and not a surprise, that the women's movement there, and represented by APNIAP, women's justice community work, like many of us up here, right? Like many of us do here in the U.S. or in other spheres, they were doing in South Asia. And they said, yes, the last person is the last girl. And they made that part of their platform, their political strategy, the work that they are doing both in the community as well as, raising as a political platform and forum, that really to end violence, it's to focus on the last girl. And when we were there, so that's a picture right there of me actually in India with the Move to End Violence team together with Last Girls and folks from APNIAP. So, and you can see the babies and the women and all of us are really coming together to focus on the last girl. And I feel like for myself, I'm born and raised here in the U.S., here in California, and I feel like for my race and gender centeredness, I really resonated. Yes, what you're saying is last girl is what we here in the U.S. have called margin to center, is that if we bring our experience as advocates and also those survivors in our community into the center, that is where all boats will rise.
That's really, really great and empowering to have that cross-cultural learning too and learn from APNIAP. I'm wondering if you can share what your personal journey has looked like. So I gave a little bit of a bio for you, but how did you shared a little bit right now how you came to looking at centering the margins, but can you share more about your journey?
Yeah, thank you. So for my journey, that's great you even have that little picture of it, is that really I was always wondering that, like many of you here in this call, is how do we center race and gender? And, I have stories of that since my first racist experience growing up here in the U.S. and also those before me. That is actually rising to the top for me. So this is a side story. I could talk about that more later, but a side story is for myself as third-generation Japanese American, born and raised here in California. I was born shortly after the Japanese internment institute, and that is where Japanese Americans on the West Coast were incarcerated during World War II because of the threat of and thinking that these are folks that could be abuse, creating violence in the U.S., but it wasn't just looking at violent folks. It was all people. So anybody of Japanese American descent was put into incarceration. And so my parents, my grandparents were all incarcerated, and it wasn't until when I was born and growing up, it was after World War II, and so we were free, but there was still a fear like we must obey all of the laws and the rules, and of course, which we would, but like feeling like we couldn't leave our community or our homes and fearful of what might happen. And it wasn't, and then also ashamed of ourselves, like, oh, well, we've done something wrong. That was why we were in these internment camps. My parents graduated from high school inside the internment. And so it wasn't until 1988 here in the U.S. that my generation actually was able to fight and put forward the Civil Liberties Act of 1988, which was a redress movement. And because of that, actually, the president at that time and they were able to send an apology to us and a redress amount of funds, like we got $20,000 as an apology and a fund to say that, yeah, that to right a wrong, that you shouldn't be put into that incarceration, and this is our apology to you. I remember that day. So 1988, I was turning 30. My parents were 60s, and they were so proud. And that I remember they even took that letter and they posted it up at our house, and that more than the money, it was like that they felt proud of themselves. And then they started talking and telling me about this secret that was not our fault. Also, with the $20,000, my dad and many other gave it back. So in my dad's, he pulled together his redress and made a scholarship for kids so that the next generations would be able to get an education away from incarceration and understand. And to this day, we still had that scholarship, and I gave the last one just this couple months ago. And it meant so much to me. My dad actually passed in 91, so he would have given that, and he'd been so proud to, offer the scholarship. So in standing in his footsteps, I gave that last scholarship. And now I'm kind of thinking, okay, for us in the third generation, let's keep that scholarship going, and for myself, I just turned 60, and I'm thinking, can I do what my dad did? Like, I think I can carry on and pass on. So that's what I also want to do for all of you on this call and our next generation, and it's with intention that I've been able to survive and live, and I also had a near-death experience 4 years ago. So now more than ever, I feel like it's with intention and love and fierce, brave space that I want to continue with this race and gender justice and equity. So with that, that's where I have continued on with that through the Gathering Strength Project, through a project out of the Move to End Violence graduation to really create a project called Communities, Building the Power of the Margins. And that's the journey that I want to continue to do. How do we, out of that is popping up my project, Gathering Strength, is really how do we collect up and center, and not in a way that is tokenized or invisibilized or seen as an extra, but really how do we all of us, make a powerful movement about that by centering the margins?
Thank you for being so open and sharing your story. In the text chat, I'm seeing a lot of people are inspired and saying that's an amazing story. Thanks for sharing. So it can be hard on platforms like this when you can't see the audience, but people are very appreciative of what you're sharing. And I know you're going to get more into gathering strength, but first, can you share something from earlier on in your journey of an example of how you've gone about centering the margins, maybe during your time at the Asian Women's Shelter, or
Yeah. So one is that in this movement, I was excited that, yes, I can really live and center race and gender justice through a domestic violence shelter. And I jumped in, and I was so excited, and I was hired by a white woman executive director. It was here in San Francisco, which San Francisco is 40% or more now growing percentage of the population is from Asian Pacific Islanders. And there's like 80 different languages that are people's first language here. And so it's very multicultural, multilingual kind of community. And so I said, yes, I go in, and to my surprise, I was the first and only Asian woman advocate that had worked in that shelter. And that shelter also had a Latina name to the title of that shelter. So here I was thinking, this is where I'm going to live my work of race and gender justice. But unfortunately, it was overshadowed by racism in that domestic violence shelter. And the woman that was so wonderful and open-minded and now advanced before her time to hire me, and she also hired 2 African-American women, and we were the first women of color in that shelter staff. Then she had her first baby, and she quit as executive director, and the board there, again, all white women, took over the shelter, and they had one of those white women board members become the executive director, and that woman did not embody the same kind of openness that the one that left, who's still near and dear to me and really was ahead of her time. So what we did was actually we experienced a lot of racism. Things like me and my 2 African-American sisters who were working in that domestic violence shelter, we'd go to lunch together, and then we were allowed not to go to lunch together. They wanted to separate us. I think it was that they felt threatened when we came together, even though we were doing good jobs as women advocate, children's advocate, volunteer, coordinator. They even put me in my office that was in the attic of that shelter to isolate me from the others. I feel like that is kind of a divide and conquer kind of strategy, and I would put that with love and attention to all of you here, is to really be mindful about how we're allowing folks to cluster, not to be in a clique or to be in a negative way, but there's a lot of positive ways that we need to have our brave and safe spaces. Okay, from that, then I think that was smart and strategic. My 2 African-American sisters quit domestic violence field, and they went into other fields, which they continue to do now. And even though I felt so committed to ending domestic and sexual violence, I felt torn. Do I really belong here? And so then I did finally quit. And luckily then, though, at that time, I got together with some other women of color sisters, and we actually started the California Coalition, a Women of Color Caucus, to address that. And that was really a place where I felt okay, I belong in this movement. That is where I met Beth Ritchie, Catlin Fullwood, Nan Stoops, many others who have continued to evolve and grow and move forward our movement. My own journey was that I decided to start Asian Women's Shelter, so a way in San Francisco to be able to meet the language and culture needs of domestic violence survivors. And with that intention, when I started Asian Women's Shelter, I actually found my own home, a place where I belong. And that helped me grow and evolve and make my best contributions to this violence against women movement.
And what about other intersections that have come up? I know that we had talked about centering LGBTQ populations through your work at Asian Women's Shelter.
Yeah, thank you so much for that prompt. Is that, my third staff person, so my first staff person was Maysing Saturn. So myself and Maysing were the first two staff people, which she still is with us. Asian Women's Shelter celebrated their 30th anniversary. So just this last weekend, I was able to celebrate together with Maysing, who's still a woman advocate there. She is such a champion and deep person, and we learned together. So that tells a lot about how Indigenous people really center in the work, and there's so much we all can learn from in that. I could tell a lot of stories there. The third staff person was when I was able to raise enough funds to have 3 staff people. I wanted to hire a volunteer coordinator and somebody who could really, and we had invented the multilingual access model, a way that we honor and uphold bilingual advocacy, and so she could run that, and it was Christy Chung. And when Christy learned about domestic violence, and this is a story that many would be familiar, and many of you have yourselves, when you learn about domestic violence, you recognize it within yourself or your family or your community. Oh, this happens here. And Christy in the LGBT community in San Francisco said, you know what, this happens and there's no name for it, especially in our API communities. Many of us came to San Francisco or are here, and it's a place where really LGBTQ rights were being centered. So some folks, even if they were rejected or even with the well-intention of their own families or communities geographically, they would come and they felt like San Francisco Asian LGBTQ community is their chosen family, right? So then what happened when there is an abusive relationship, that it's not just one partner, one abusive partner against you. It's like how you're being seen and how you're coming out in for your own family, your own community. And so a lot of the domestic violence, like say a domestic violence shelter, making you safe from your one abusive partner, yes, and not all the ways that you could be safe in your extended family. You need an extended family that gets what's going on with you and helps stand up with you as a survivor, as someone who's been experiencing harm. So from that emanated our queer Asian women and transgender support component. And not only that, but we felt like, I knew what it was like to be experiencing a racism, and then also having to carry the burden of the one that educates those that are racist about what anti-racism is. And I felt like I don't want to replicate that, and I have the privilege of being a cisgendered person to identify my heterosexual privilege. So I felt, you know what, it needs to be us. Yes, the term allies to be in sisterhood and partnership, but also we're the ones that need to address racism, homophobia, and all of the isms, the center of that. It's us that need to do that. So we created what we called, also way back in the days, I don't know if you guys know the story Ghostbusters. That was a big popular movie during that time. So then we named ourselves the Homophobia Busters. Like, that's our job to break that, that's our job. Not those that are experiencing that harm, but us. And so that's what we were. I think they might still call themselves Busters, AKA name,
And this really connects to prevention, too, because it's really making it a community issue and all that kind of thing.
Exactly. It's so much prevention. And so what we would do, it was our job to do that in the shelter with all of the survivors that were staying there, to really talk about LGBT liberation and rights, and to erase our own homophobia, but also to be able to have the safe space to speak up about it, and then also in our communities as well.
So if we go to the next slide, I'd love to hear from the audience again. I know we've been getting some more remarks saying, way to go, and thank you for sharing and all of that. But we'd like to ask another question to the audience, asking all of you, how do you try to recenter power in your work? Or what ideas do you have to recenter power? And while you're typing again, I'm going to ask a question of Becky. I know more recently you mentioned already gathering strength, and you've been doing a lot of work to support women of color in the movement who are trying to recenter power. So can you share more about what gathering strength is?
Yeah, so I feel like I used that term gathering strength when I was at Asian Women's Shelter, because there we were centering ourselves and our people. So I thought, yeah, that is gathering strength, that we need to look inside and gather strength so that we can do the outside work and make our best contributions to the movement outside and prevention. And so then actually I was invited to do a keynote speech at the Millennium Conference. So this was at the brink of the millennium. So 1999 in Chicago, a national conference. And I decided, you know what, I'm going to talk about gathering strength. And so then in a keynote speech, I said gathering strength, and it was a call to action that, okay, we're a success as a growing violence against women's movement, but on the brink of this 2000s, we need to gather strength. And what it was a call to action. We need to gather strength first by celebrating our accomplishments, and then I talked about that. Second, by really not replicating things that are not centering in the margins. So I think maybe the term last girl, which I didn't have at that time, but really what it means to center around race and gender. And then I gave examples of how that really benefits all of us to do that kind of centering. I talked about how we need to, and it was like a call to action for domestic violence shelters and rape crisis centers that should celebrate their success, but not just keep replicating with an untouched agenda. And that was my example of, oh, that doesn't mean, yeah, I am racially diverse, because you hire, like my own experience, one Asian person to cover the whole, which is really half the world, if you look on an international basis. And then also with language and cultural access, and then just centering it because of cultural practices, right? Not just language. Anyway, so I could go on and on, but that was gathering strength. And then after I did that rallying cry on that, I felt like, you know what, I can't just make a call to action. I felt a wonderful opportunity that I got to make this keynote speech, but like, okay, let me put my words into action. If I'm calling to action that, what am I doing to gather strength? And so I took those 5 parts and really made a program, Gathering Strength, which is a cohort leadership development program intentionally centered on outliers. So here I am in California, and I got a California grant from Blue Shield of California, which I totally love and appreciate that they took that challenge like, okay, we don't totally understand what you're talking about, but yeah, let's try it out. So we did start that. We had our cohort 1, and we were able to create a leadership development program that could really center those leaders and their community work at the center of our movement. So that's gathering strength. This here is a picture of then we had a reunion that we're growing. Isn't that funny too, is that, being also a member of Move to End Violence and having that opportunity to be in cohort 1, now they're in their cohort 4. I wanted to design Gathering Strength for outliers in that way, and so I was like, okay, now we got a grant, we could be cohort 2. And they said, no, we don't want to be cohort 2, we want to be cohort 1.5. Isn't that interesting? Because that's how generations are here. So it's the immigrant experience too. Like in the Korean community, for example, they say like, I'm a 1.5 generation, meaning like if you're born, maybe you were born here in the U.S., but you were young, or you were even born in your home country, and then you were here as a child growing up here. So that kind of is 1.5, You are a transnational person, an international citizen. So that's what we're doing also with Gathering Strength.
So can you share an example of, I know Gathering Strength has really helped cultivate and support a lot of leaders, and can you give an example of one of the groups maybe that has been part of Gathering Strength?
Yeah, there's so many stories that I'll start with the next slide, Himalayan Sisterhood. So I want to shout out, and I do have her permission to do this publicly, Detchen. She was one of our Cohort 1 Gathering Strength members, and they're also actually, they coined themselves, they're calling themselves OGs, and we don't mean the original gangsta, we mean the original girl power. So in Acha, her story was, in this cohort, she was starting a program called Tibetan Sisterhood, and she had about 100 Tibetan women here in the U.S. that wanted to be part of this Tibetan Sisterhood, which would really address gender-based violence and other women's rights issues in Tibetan women's lives here and internationally. And she was also the president of the Tibetan Community Center, which had a membership of Tibetan community members. And she had been a former president. She was no longer the president of that. It's an elected membership community center. But she thought, well, of course, this could be a chapter or committee of our Tibetan Community Center, the Tibetan Sisterhood. And so she approached that, and that was rejected. So she was rejected by her on a race issue by her own Tibetan people. And at that time, it was because, you know what? At this time, we're trying to free Tibet. The nation, Tibet nation, is our number one priority. And if we talk about these problems around domestic violence or sexual assault within our community, that's going to diminish what our nation looks like. So we cannot have Tibetan Sisterhood be part of the Tibetan Community Center. Nationhood is number one. And, of course, for them, for freeing Tibet, the nation, they wanted to be loyal to that. So everybody dropped out, all the 100 women except for Detchen and 2 other Tibetan women that said, no, you know what, our story, our making women's rights, human rights, is part of having a free nation. And so they did not drop out. That it wasn't part of Tibetan Community Center. And she was telling us, that had just happened, she was telling us that on like a cohort call at Gathering Strength. And can surprise but not surprise, every single one of us on that call had a story like that. I said, yes, I totally can relate to that because when I started Asian Women's Shelter, there were some progressive API folks here that I thought were my brothers that said, no, you can't start Asian Women's Shelter. That would be like race traitor, I was called, and they actually published it in a progressive API newsletter. And then on the dominant culture domestic violence side, there were domestic violence shelters like the one that I had left that said, no, you can't open another shelter. You're taking away from our funding, but there were also those that believed in us that could live the race-gender equity. So there were many reverends, leaders, others across the gender spectrum in the API community that said, yeah, we're behind you. That is, I had reverends that said, yes, that's something we can't do in our church or our temple. Go forward with Asian Women's Shelter. You know, there were folks on the LGBT side, the DV shelter side that said, on the DV shelter side that said, yes, we need that. We can't do the language and culture and center it in that way. We need that. Let's go. And then supporting and sharing resources across issue areas like LGBT Center, like in San Francisco, Communities United Against Violence, folks that were LGBT-centered said, yes, we need that for our people and move forward.
And in Detchen's case, Detchen was able to go on and create.
Thank you. Yes. That was so brilliant. So Detchen, in her own mind, so I want to do a shout out and so proud of her. When she heard all of our stories, she realized, number one, she was not alone, that this is a bigger race-gender story, and that it's important for us as women of color, as whatever ways that we are identifying in the margins, being in the center really rises all of us. And so she had this strategic, brilliant idea that she decided, okay, we're not Tibetan Sisterhood, we're Himalayan Sisterhood. And she invited in the whole Himalayan range, which many in South Asia, in many of the different programs and ways geographically that folks are identifying, welcomed and invited in. So now it is called Himalayan Sisterhood. That allowed Tibetan women to join in a larger way. That's not just about nationhood. And it invited in South Asian folks, immigrant, refugee folks that are all working towards Himalayan Sisterhood and working for empowerment and against violence against women and children. So 100 plus joined in again, and they are all helping us all rise.
Awesome. We love your storytelling and sharing. We could just listen to you all day. Let's hear what's coming up from the text chat, and then I think we're going to need to move to our other guests, and then we have time at the end. We'll get you to share more, Becky.
Yes, thank you. Looking forward to hearing from Lucy.
Yeah, so first let's hear what's been coming up in the text chat around recentering power. What are folks doing? What ideas do they have?
Yeah, you all have some really great ideas, both in action and brewing, too. So thank you all for sharing those. Alejandra brought up a lot of really great points that I wanted to highlight. One of them being to hire marginalized folks and support them with their needs, not having your support match your needs, but meet the needs of the folks that you're hiring. And we also heard a lot from folks about uplifting voices of people of color without tokenizing them, too, specifically uplifting those voices to white audiences. I also saw things about yielding the floor and yielding our own power to our audiences who may not share our identity, specifically with youth of color, and a lot about calling in and supporting leadership as well. So, Ashley or Alicia, did you have any other themes that you wanted to bring up?
I saw a comment earlier that Becky, the racism that you were speaking about that you faced was really resonating for other women of color who are working in sexual violence and domestic violence movement. And so, when I think about recentering power, I think it's so important for white women, I'm talking about myself, and fellow white women, for us to really work against the tendency to perpetuate racism in our spaces in order to not recreate these systems and spaces for women of color who are doing this work alongside us, ahead of us. I think that was something that really stood out to me that I just wanted to highlight.
Thanks, Ashley, for
Yeah.
And I think that there's just so many connections to centering the margins to prevention, because, you know, when we allow those at the margins to lead, we can really help shift those norms and community conditions, and it really sets tone for what the norms are on whose voice is valued. I know that some of the stories that have been shared relate to both survivorship and prevention, but I wanted to pull that out a little bit. So let's do a quick sound check with Lucy. Lucy, can you say a quick hello?
Hello, I'm here. Can you hear me okay?
Great. Yes, we can hear you. We're
Perfect.
just going to move to our next slide, and I'm going to introduce you. So Lucy Rios is the Director of Prevention and Communication for the Rhode Island Coalition Against Domestic Violence, and has been in the movement to end domestic violence for over 15 years. Under her leadership, the Rhode Island's strategic domestic violence prevention initiatives have flourished, and in addition to managing the coalition's Delta Impact Grant from the CDC, Rios also provides training and technical assistance to diverse community groups and organizations, and oversees the coalition's public awareness campaigns and communications efforts. So we're really happy to have Lucy here today to provide a coalition perspective on this topic. So Lucy, how has your coalition as a whole demonstrated its commitment to health equity or even centering the margins?
Yes, so thank you so much for having me. I'm really excited to be able to share some of the ways in which the Rhode Island Coalition has been intentional about becoming an anti-racist organization and how that's helped to advance our health equity work. And so the slide that you have in front of you shows some of the ways in which we have worked internally to address anti-racism and externally. So it's been really important for us, since I joined the coalition, we've been intentional about unlearning so much of this about oppression and racism in our organizations. And so what we've done, in addition to participating in ongoing training, we've created self-facilitated conversations quarterly as a staff to help us, again, unpack some of these, unpack the isms and how it's showing up in our society, but more importantly, how it's showing up in our own institution. And so we have used this great tool that I'm sure many of you on today's call are familiar with. It's called the Habits of White Supremacy Culture. And we have literally used that document to try to change some of our practices in the organization in an effort to become an anti-racist organization. So some examples that you have in front of you is around the hiring practices. And when Becky was talking, I was like, yes, 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 this is so important because as advocates of color in this work, we are also facing institutional racism and racism in our own organizations and in our communities as we're doing this work. And so not only are we intentional about our hiring practices, but we spend a lot of time thinking about our culture and thinking about the ways in which we're going to retain the staff of color that we bring into the work. And create a culture and an environment where the advocates can be their whole selves, right? And so that they don't have to hang up, on what's happening in their personal life when they walk through the door or conform to a certain way of behaving, but really be able to come in and express themselves, share their passions, their worries with one another, and know that they're coming into a supportive place that not only wants them to feel at home, but welcomes them to be able to express their whole self. Another way that shows up is through our communications work. And that, again, being intentional about not only making communities of color visible in our outreach materials and our public awareness campaigns, but then also in supporting and amplifying the voices of organizations that are led by people of color in our state. Again, with our policy work, we see some examples of that again, thinking about the health equity frame, and as an organization, when we have started to really focus on health equity and having that translate into our policy work, we started being more active on policies like paid leave, the Fight for 15, mobilizing our task force of survivors on other issues, other bills that aren't necessarily domestic violence specific bills, but we know can improve the quality of life for all Rhode Islanders, including survivors of domestic violence. And so another example of how we've been externally applying health equity and our anti-racism values has been in just a strategic decision that was made a few years ago around creating a community engagement department at the coalition. And so I saw that Deborah DeBear is on the call today, and under her leadership, she's our former executive director, so I'm giving her a shout out. Hi, Deb. But also for the wisdom of seeing if we are thinking that we want to be in deeper community with organizations that serve and are led by people of color, we needed to show that in our organizational structure. And so as an organization, we created the community engagement department and now have brought on 5 new affiliate members, some of which are culturally specific organizations. And again, it isn't because we're trying to alienate our existing member agencies, but it's in a real recognition that in order for our movement and in order for us to really be taking more direction from communities of color in our own state, that we needed to be in deeper partnership with them. And so then being an affiliate member then opens the doors for ongoing conversation for us to be able to learn from them about the ways in which we can support their own efforts to address domestic violence in their community. It brings resources, not only financial resources, but resources of staff, being able to provide training and technical assistance within those organizations. So those are just some examples, again, of the ways in which our organization has been intentional about advancing health equity externally, but then also the deep work that it takes internally to be able to do this work and transform the way that we traditionally have done things as an organization.
Thanks, Lucy.
Sure.
I just want to go to the next slide here. So I want to ask the audience, now that you've heard from Lucy about some types of internal practices that the coalition has done to really think about health equity, we'd like to know from you what policies or practices are in place to support health equity in your organizations. And if there aren't any, what ideas are you trying to advocate for at your workplaces? And while you're typing, again, I'm going to ask Lucy another question. So you've given us a really great overview of coalition-wide practices, but I thought it would be great if you could share a little bit more about the ways that your prevention work supports health equity. So can you share some examples?
Yes, I can. So one of the things, and I also do want to give another shout out to my colleague Cynthia Roberts, because I see her also on the call. I think one of the practices, in addition to the ongoing training and our anti-racism, quarterly self-facilitated conversations as a staff, we also keep it present on our agendas as creating space for staff to identify when we are working outside of our values, but then also as important, affirming when we are living into our values and recognizing how difficult it can be and challenging it can be when we're facing and working with organizations that don't traditionally operate in the ways that we're trying to operate in. I think one of the practices, thinking about our prevention work, is around empowerment evaluation. And so that's why I want to give a shout out to Cynthia, because she's been really key in helping support the staff in understanding what that is, and it's basically helped build the staff capacity to understand how do you use evaluation methods as a way to improve the work that you're doing, but also engaging the staff in developing their own tools and helping to collect the data and make meaning out of the data. And the same is true for our prevention work and the strategies that we've done are implementing in our state. So one of our initiatives is around 10 men, and we are, working in partnership with the participants themselves to, again, design some of the evaluation questions to help us understand what we're looking at once we've collected the data, and to help us make meaning of what that is, and also to help shape the future direction of the program. And so I wanted to share on this, what you're looking at there is an example of a way in which we've done that. And so the slide that you have in front of you is from one of our affiliate members, the YWCA, and they are a recipient of funding that the coalition has been able to give out as a result of the Domestic Violence Prevention Fund, which is state funding dedicated exclusively for primary prevention efforts in the state of Rhode Island. And the way we designed this RFP, again, is an example of how we've used health equity lens to make sure that we're putting resources in the hands of community members and groups that haven't traditionally been the recipients of our funding. And so what we did was we looked at YRBS data, and we saw that in Rhode Island, 17% of youth, high school students, were reporting experiencing some form of dating violence or sexual violence in their relationship. But then when we looked at the LGBT community, we saw that number jumped up to 32%. And so we had this opportunity with this funding and with the coalition being the administrator of the funding, that we could design the RFP to specifically address working with those communities. And so we did that, and we looked, we put out the RFP, and so the YWCA was one of the organizations that was able to receive that funding. And so what they did was they really wanted to center their work around young girls of color. And so they had a twofold strategy. So the first part was they were targeting all youth workers that were interested in implementing a Girls Circles program, and invited them to a 3-day training with them on racial justice. And then after they completed that training, they then offered them a 5-day training on how to implement Girls Circle. So the photo that you have there is some of the girls that participated in the program. But what was really exciting for us was that we were then able, through the same pool of money, fund another organization called ARISE, which stands for the Alliance of Rhode Island Southeast Asians for Education. And they were the recipient, they participated in the YWCA's racial justice training, and then they participated also in the Girls Circle training. And then they took that program and made a cultural adaptation. And so you see in the photo in front of you is that first thing they did was they named the program Hidden Lotus, and then they switched to a co-ed model instead of a girls-only model. And they worked with our coalition and with the YWCA to evaluate that work and to figure out, as a result of the adaptation, did they still get the results, the goals that they had set out for themselves and reach the outcomes that they had identified in their grant. And so they're just about finishing up. That grant will end at the end of this year. And so we'll be getting, hopefully we'll be invited back to be able to share more about what we learned about that. But to date, from what we hear from them, it's been very successful. They've been able to retain a lot of the participants. They've engaged over 35 youth in their program to date. And it's just really exciting to see this little, we give them very minimal funding to be able to do this work. RISE received $15,000 to adapt this program for a year, and it's been amazing to see what they've been able to accomplish so far.
That's awesome. And then back in 2016, we actually had Olivia from the Women's Resource Center share about work that's happening in Newport, Rhode Island, focused on creating a health equity zone. So I know that's something that the coalition has been involved with. So we're wondering if you could share more about what that project's about and where it's at as the project's progressed since 2016. And we'll also share the web conference that Olivia was on in the text chat in case folks want to check that out.
Yes, and I invite them to check it out because they have done amazing work in Newport. So just really quickly, the Newport Health Equity Zone is a collective impact place-based project. It targets two neighborhoods in Newport, the Broadway and North End area, which are basically the low-income neighborhoods, the most racially diverse parts of the city, with a high concentration of poverty, particularly for communities of color that are living there. And so with the Health Equity Zone, they have focused on mobilizing their residents. So it's really community resident-driven work. And with the purpose of eliminating health disparities and also reducing chronic disease. So some of the things that they've been able to do in their community have been around diabetes prevention work. They've created walking paths. They have farmers markets. They've been working with transportation to help create safer streets. So they passed an ordinance for green and complete streets. And right now, we've been really lucky to partner with them through our Delta Impact funding to be able to focus more on greening urban spaces in Newport. And they already had the infrastructure in place with the Newport HES, the Health Equity Zone. They already had a strategic plan that really lined up well with looking at open space. And when the RFP came out for Delta Impact, this was one of the areas in which communities could apply for, and it just made total sense for us to partner with the Newport HES to look at open space. We know that there's some research that shows that open space can be linked to reductions in violence, and so again, when you think of ITV or intimate partner violence prevention, you don't immediately go to this type of work around open spaces. But for us, it was a no-brainer, and we're really excited to be able to be in deeper partnership and community with the Newport HES and the folks around that table.
That's great. And it's great. Thank you for making the connection to greening urban spaces, to violence prevention, to health equity, because it's not always clear immediately. People don't get it right away of how it all connects. But, yeah, there's definitely research, and I think even research that connects to domestic violence specifically.
Yes.
And I haven't looked at the research for sexual violence, but there might be research on that, too. I'm not too sure.
And one of the things that we're looking to do with the Greening Urban Spaces work is conducting a health impact assessment. So really looking at if a new development is brought into the area, what will be the impact on the residents' health as a result of that. So we're going to be partnering with the Human Impact Partners to do that. And hopefully, I know another exciting, I thought, and very innovative idea that they're looking into is establishing a community benefit agreement with the city so that should new, and this hasn't passed, but it's on their list of things to do, and I believe they'll be able to do it, so that if there is any new development or ideas, plans brought into being considered in their town, that there's going to be a stated benefit to the community, whether that's that they will build this new, building, but they will dedicate some space for either open space or maybe the community can have access to like the swimming pool or whatever the agreement ends up being, a commitment to lower or affordable housing. So all of that, I think, is pretty exciting to see how that all plays out in the upcoming years.
And I know with the health impact assessments, there is the added layer of health equity in it too, and
yes.
thinking about how it affects populations that are most marginalized. So, yeah, we look forward to following up and hearing more about this project as it continues. So overall, with all this different health equity related work that you've been doing, what kind of challenges have been coming up and how are you going about overcoming those?
I'm thinking of the two challenges that I think would be beneficial to share. It's like the first being that in Rhode Island, I mean, we're a blue state, we're a progressive state for the most part, and I think because of that, when we come to the table and we're talking about health disparities and health equity, that folks around the table as systems may just think that it's implied, like we don't have to have an intentional focus on it, that it's maybe like unnecessary because they're assuming that, you know, we have that covered, that we've been doing that work, and that because we're a progressive state, of course, things that we're putting forward are going to be inclusive of everybody, and we know very much that that isn't true. But that is a challenge that we've been facing. And I think another one that we've been facing both at the state and at the community level is when you are doing social determinants of health work and health equity work, you're really not just thinking about your own systems. You have to be in partnership and working with, you know, education and transportation and planning. And those systems generally lack transparency. They very much operate in a very paternalistic manner where, you know, the experts are at the table making those decisions, and they're not used to engaging community residents and community people into those conversations. And they might question, like, well, what is this CV agency? You know, why are they at the table? Why do they think that they have ideas that we should consider? And so I think figuring out, you know, how to navigate those different systems and even just knowing enough, like, how can I influence the decision that's going to be made? It's been a real challenge for us. Yeah.
I like that both our guests today really got to the need to change systems and how that's really important for health equity and centering the margins. And so I'd like to bring back Becky as well as we get to the end of the session. Want to give each of you a chance to kind of share your key takeaways or tips for all of those who are participating today. So Becky, let's start with you. What would you like to share?
Yes. Well, of course, shifting purpose to every last girl, meaning the stories that I told about that, and that Lucy, I'm just still enraptured by the stories and the excitement about the YWCA racial justice and the Girls Circle Group, the Rise. I mean, those kinds of examples, I think all of us, as well as those of you listening in, have those ways that we can really shift purpose, and that is like through building the infrastructure that supports those margins to lead. So really, like, of course, our feelings and our actions, but also like changing the conditions, like really like paying attention to those invisible ways that we are apparently invisible ways that we need to change our infrastructures too. And I feel like lastly, like when I say caring for ourselves and one another in the movement, yes, definitely that heart and, you know, just really seeing ourselves. I want to just use my 50 seconds left to really just quote and invoke Grace Lee Boggs. she's passed. She had a long history and leadership with us. But one of the many quotes that I cherish and I look up to, she said, "We never know how small our activities, or the small activities that we do, will affect others through the invisible fabric of our connectedness." And so in this exquisitely connected world, it's never a question of critical mass. And I really think about that because I'm always like, yeah, critical mass, come on, we need to get the numbers. And yes, that is true, but Grace reminds us that not so much critical mass, but really it's always about critical connections. And so with that, I feel deeply interconnected and intentionally interconnected with all of us together. Thank you.
Yeah, no, thank you. And that really connects to how this is called Prevent Connect, and it's really about the connections that we're building. So even though it's just over a web conference, we're really trying to build the critical connection.
Yes.
So let's also hear from Lucy. What would you like to end off with today?
Yeah, thank you. Well, very similarly, staying committed to learning and reflection, self-reflection, remembering that our societal institutions and structures, they're not designed for us to use a health equity lens and approach to our work. And so it's going to be hard, and we have to just be prepared, be bold, and not be afraid to challenge the status quo. I also included being kind to yourself, and I should have said be kind to yourself and others. But this work is really hard, and so we can't do it alone. And in order to be resilient, we have to practice self-care. We have to have that base of support for ourselves, but also that building a base of allies as we go and try to do this work. Being intentional about this work means not going at it alone and really knowing who are your allies and bringing them with you so that you feel strong enough to keep going and not quitting. And just being, again, the last thing I'll say is just being comfortable with making mistakes. That we're not going to get this perfect, but we can't allow that perfectionism to get in the way of us trying, just taking risks and trying something out. So that's all.
Great. Well, thank you both for everything you've been able to share. We're going to move over to our resources for today before we end. So if we just go to the next slide. Great. So again, we have the previous web recording that featured the Newport Health Equity Zone work. So we invite you to check that out. Also, if you want to learn more about the Rhode Island Coalition, there's their website that you can go to that has some information on the prevention work that Lucy mentioned and other information as well. We also, Becky mentioned Move to End Violence and being part of that cohort. So part of that, Becky wrote a lot of blog posts. So we invite you to check those out if you want to hear or read more of Becky's stories. I know a lot of you enjoyed the storytelling. And then there's also a resource from the Movement Strategy Center and the Move to End Violence called Movement Building Practice, Margins to Center, which I think goes through some activities. Is that right? Yeah. So you can take a look at that too. We're sharing the link again in the text chat. And Prevention Institute, I know we're throwing a lot of resources at you right now, so they will be available through the webinar link as well. But Prevention Institute also has a new resource about partnering for health equity, which is really focused on the public health agency side of things. So if you come from that world or are partnering with folks in public health agencies, that would be a great resource to look at as well. And then lastly, we featured this one before, but Prevention Institute created a report on a health equity and multi-sector approach to preventing domestic violence, which came out, I think, last year or so. But we also just released kind of a more summary document of that. So it's a brief called An Overview of the Sectors Acting for Equity Approach. So it includes some community examples of what different communities are doing to advance a health equity and multi-sector approach. So be sure to check out that brand new resource. And with that, again, thank you to our guests. I'll let Ashley close us out.
Thanks, Alicia. Well, thank you all so much for joining us today and for participating in this conversation. I know that it is a conversation that we plan to continue, and it's so important to the work that we're all doing. So thank you to my colleague Tori, to our Prevention Institute team. Lucy, I am always so excited about the work that's coming out of Rhode Island, so thank you for coming on and sharing that, and we look forward to seeing what happens in the future. And Becky, it's been such a treat to be here in person with you, and for all of you who enjoyed Becky's storytelling, I think all of us around the table here in person were just like all ears and did not want to interrupt to move on to our next slide. So thank you so much, Becky. We hope that you will join us in October for our next web conference looking at economic supports and opportunities to advance sexual and domestic violence. And again, that will be on our new Adobe Connect platform. So thank you again, and we hope you all have a wonderful rest of your Wednesday. Take good care, and we'll talk with you soon. This ends our web conference today.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CalCasa.org.